Okay, so we are going to do the eye exam. So I'm first just going to start by observing the patient, looking at the symmetry of the eyebrows, eyes, eyelids, eyelashes. The eyelashes should be curled out and up. They shouldn't be going into the eye. And then just looking for any obvious signs of infection, inflammation, swelling, edema, crusting, anything that would indicate an infection. Okay, and then we're just going to observe the conjunctiva and sclera, looking for the blood vessels, seeing if they're super red or inflamed, any more obvious signs of infection again. And while we're doing this, we're observing the eyes for any signs of glaucoma or cataracts, so looking for any cloudiness in the eyes. Okay, and then I'll just have you blink. You're just going to watch while I blink, make sure it's even, equal. There's no catching or slowness to either of the eyes. Then we're going to do the exam with the ophthalmoscope. You're going to have it at about 75% light. You're going to focus it in at 15 feet, which we did before this. I'm going to come in at an angle and follow the red light reflex into the eye. Patient relaxed. In. Okay, turn this way. In. And when you're doing this, you are looking at the back of the retina. You'll follow the blood vessels back to the optic disc. You're looking at the borders, they should be sharp. You're looking at the color, it should be a pale yellow. You're looking at the size of the physiologic cup, which should be about half the size of the disc. And you're looking for any normal variants such as crescents and noting their position, and then you're looking for any abnormalities as well. And you're going to look at the vessels for the color of them. Then we're just going to do some palpation. I don't have gloves on, but I would have gloves on. I'm just going to palpate the lacrimal gland and the sac. And then I'll just have you lightly pull down on your eyelids, and I'll have you roll your eyes up, looking at the sclera and the conjunctiva. Good. And then once again, we'll look at the cornea and the lens, looking for any signs of cataracts again. Okay, and then we will do the perla test. So we're looking at the pupils. They should be equal and round. Okay. Then we're going to take the pen light, look at the light we're bringing, or the eye we're bringing the light to. Pupil should accommodate, or should shrink. And then we're going to bring the light to the same eye and look at the opposite pupil for the reaction. We'll do it on the other eye. Okay. And then accommodation, I'm going to put my finger just a few centimeters in front of the patient. I'll have you look at my finger and then look off into the distance and go back and forth. The pupil should shrink and grow when the patient changes. Okay? Then I'm going to do the corneal light reflection test. I'm going to put the pen light right in the middle of the bridge of the patient's nose, and the reflection should be equal on both sides. Okay. So I'm going to, and it's equal. Then I'm going to do the H pattern. So I'm just going to move the pen light in an H shape. I'll have the patient follow it. So follow it with your eyes, not your head. Looking for any catching or differences between the muscles in the eyes that could indicate weakness. Good. Then we'll do the visual fields test. So I'm just going to stand behind the patient. You let me know when you can see my hands come into your field of view. Good. Good. Coming from the same direction on both sides. Then lastly, we're going to do the visual acuity test, which we need the eye chart for. So I'm going to turn the screen this way. I will have the patient stand. I counted it out, that's about 20 feet, so I'll have you stand behind that line. And I'll have you cover one eye and tell me which line you think you can read.
I can read 10.
Okay.
FDPLTCRO.
And she got all but one of those, so then can you read this bottom line?
FEBOLGTL.
And she didn't get at least 50% of that one, so her vision is about 20/13 in that eye. So then flip to the other eye. And which line do you think you can read?
10.
10.
FDPLTCBO.
Yep, and she got more than 50%, so can you read that line?
FEBGLGFTS.
She didn't get 50% in that one either, so she's about 20/13 for her vision. Then lastly, I forgot to do the cover uncover test, so we'll just add that to the end here. I'm going to cover one eye and just look for any deviation of the covered eye or any deviation of the uncovered eye. And there's no deviation on either side, so good.